Welcome to this explainer on concussions. We hear the word concussion tossed around constantly, right? In sports, in the ER. But what's actually happening inside the skull when one hits? Today, we're doing a deep dive into the invisible but absolutely critical mechanics of mild traumatic brain injuries. Okay, let's jump right in. Imagine this scenario. A football player takes a massive hit on the field. He gets up, he's clearly dizzy, maybe he doesn't even remember the play, but he brushes it off. He tells the coach, "I'm fine." So should he stay in the game? The answer is absolutely, categorically, no. While a concussion might look mild from the sidelines, it is a traumatic brain injury. It temporarily scrambles normal brain function, and if we ignore it, well, that can lead to prolonged symptoms, repeated injuries, and in some rare cases, life-threatening brain swelling. Here is our roadmap for today's explainer. We'll start with 1, the mechanics of concussion, move into 2, the metabolic brain crisis, identify 3, symptoms and red flags, discuss 4, diagnosis and active recovery, and wrap up with 5, complications and prevention.
Section 1, the mechanics of concussion, from impact to brain dysfunction.
So when most of us think of a severe traumatic brain injury, we picture structural damage, things like bleeding or bruising that light up like a Christmas tree on imaging scans. But a concussion, which is a mild traumatic brain injury, is fundamentally different. It's a functional impairment. Think of it like a computer. The physical hardware of the brain looks totally fine, but the software is temporarily glitching. It really boils down to a simple equation. Mechanical force creates temporary brain dysfunction. But here's the kicker, and this is a huge takeaway. You don't even need a direct blow to the head. A forceful impact to the body alone can cause a whiplash effect, where the brain rapidly accelerates and rotates inside the hard skull. Those rotational forces literally stretch the nerve fibers, specifically the axons, which just completely jams up normal neuronal communication. Section 2, the metabolic brain crisis, inside the neurometabolic cascade. All right, let's look at the microscopic level. A concussion sets off a highly complex neurometabolic cascade, which we can break down into 4 clear steps. Step 1 is that mechanical stretching we just talked about. Neurons and axons are physically stretched by rotational forces. This triggers step 2, an ionic imbalance. Potassium rapidly rushes out of the cells, and calcium just floods in, severely disrupting how those neurons signal each other. Step 3 is an energy crisis, which is a big one. We'll get to that in a second. And this all culminates in step 4, temporary brain dysfunction. Most neurons are going to recover from this over a period of days or weeks, but during this cascade, the brain's communication network is essentially offline. Now, building on that energy crisis. After that massive ionic imbalance, the brain desperately needs glucose to heal itself. But here's the catch. The trauma has temporarily decreased cerebral blood flow. It's like pressing the gas pedal straight to the floor in a car that's running out of fuel. You have this massive spike in energy demand coupled with a drop in blood supply. This mismatch creates a profound, temporary metabolic crisis in the brain. Section 3, symptoms and red flags. Identifying the invisible. So how does this microscopic crisis actually look on the outside? Symptoms generally fall into 4 buckets and can show up immediately or sometimes creep up over several hours. Physically, you might see dizziness, nausea, or light sensitivity, though a headache is for sure the most common. Cognitively, it causes confusion, memory loss, and just a general foggy feeling. Emotionally, a patient might experience sudden anxiety, irritability, or mood swings, and it completely wreaks havoc on sleep, causing extreme fatigue or even total insomnia. But listen, here is a massive myth we need to bust right now. Most patients with a concussion never actually lose consciousness. You do not need to be knocked out to have a concussion. Now, while most of those symptoms are manageable, you have to be on high alert for red flags. We're talking about a worsening headache, repeated vomiting, seizures, unequal pupils, persistent drowsiness, or increasing confusion. If you see these, this is not a simple concussion anymore. These are blaring warning signs of a much more serious brain injury, like an intracranial hemorrhage, cerebral edema, or a cervical spine injury. And that means immediate emergency medical evaluation, no exceptions. Section 4, diagnosis and active recovery, the clinical approach. Okay, high-yield concept right here. A normal CT scan does not mean the patient is concussion-free. A CT scan is absolutely indicated if there are red flag symptoms, mainly to rule out bleeding. But for an uncomplicated concussion, that scan will almost always come back totally normal. Why? Because imaging detects gross structural damage, not microscopic functional impairment. Remember the computer analogy? The hardware looks fine. Diagnosis is primarily clinical, relying on the mechanism of injury, neuro exams, and symptom scoring. When we shift to management, the focus is heavily on active recovery, not just throwing medication at it. Immediate steps are absolutely critical. Pull the athlete from play right away, monitor them closely, and under no circumstances do they return to the game that same day. But here's a major modern shift in medical thinking. We used to prescribe complete, prolonged bed rest in a pitch-black room. Actually, scratch that. That's no longer the standard of care. Today, we recommend relative physical and cognitive rest. You want to avoid activities that actively trigger or worsen symptoms, but total isolation is actually counterproductive to healing. Instead, patients need to resume activities gradually, using a strict, step-by-step return-to-play protocol. It starts low with symptom-limited activity, then bumps up to light aerobic exercise. Next is sport-specific exercise, followed by non-contact training. Then, and only after medical clearance, full contact practice, and finally, a return to actual competition. The golden rule here? You only progress to the next stage if symptoms have completely resolved. If a symptom flares up, you stop and drop back down to the previous stage. It's a ladder, and you can't skip rungs. Section 5. Complications and Prevention. Protecting long-term brain health. Let's talk about the worst-case scenario. One of the most terrifying complications of sending an athlete back to the field too soon is second impact syndrome. It's rare, but it is highly fatal. This happens when a person suffers a second concussion before the brain has fully healed from the first one. That second hit triggers rapid, catastrophic cerebral edema, massive brain swelling. This right here is exactly why the no same-day return rule is so incredibly vital, especially for young, developing brains. And we can't ignore the long-term cumulative danger of ignored concussions. Repetitive head trauma significantly increases the risk of neurodegenerative diseases down the line, the most notable one being chronic traumatic encephalopathy, or CTE. This completely shatters the old-school idea of just getting your bell rung and playing through the pain. Every single head injury has to be treated with patience, using those proper stepwise recovery protocols to protect the patient's long-term future. Ultimately, prevention is our best medicine, and it really does take a village. We're talking about teaching proper sports techniques so athletes aren't leading with their heads, consistently wearing the right helmets and seatbelts, strictly enforcing those safe return-to-play protocols, and above all, widespread education. A concussion might be medically classified as a mild traumatic brain injury, but as we've seen, its consequences should absolutely never be underestimated. Timely diagnosis and evidence-based management are the true shields protecting long-term brain health. Understanding the mechanics of these invisible injuries can literally save a brain. So, armed with this knowledge, I'll leave you with this question. How will you step up to protect the athletes, the students, and the loved ones in your life?